39 years. That's the life expectancy researchers found for 4-year-olds with severe obesity who never lose the weight. 39. Half of what it should be. And there's one city in America where this is already happening. Children developing diseases that used to only appear in middle-aged adults. 7-year-olds taking medications their grandparents take. 9-year-olds sharing prescriptions with their mothers because the family can't afford 2 bottles. That city is McAllen, Texas, the most obese metro area in the United States. One of the poorest, one of the hungriest. And the paradox that confused researchers for years, one of the most overfed. For the first time in modern history, a generation of American children may die before their parents. Not from war, not from pandemic, from what they're eating. In this video, I'm breaking down the 5 factors that created this crisis. Factor number 1, the one nobody talks about, might be the most dangerous of all. It explains why families don't even realize they're in danger until it's too late. You'll see the statistics that shocked researchers, the mechanisms driving this epidemic, and what evidence shows can actually reverse it, before more cities follow the same path. But first, you need to see the numbers, because what's happening in McAllen right now could be happening in your city next. The statistics that break brains. Let me put this in perspective. A March 2025 Wallet Hub study analyzed the 100 largest metro areas in America for weight-related health problems. They measured obesity rates, physical activity, diabetes prevalence, access to healthy food, healthcare outcomes, everything. McAllen ranked number 1, not top 10, not top 5, dead last in health, first in problems, out of 100 metro areas. The findings were staggering. 45% of adults here are obese, not overweight, obese. The clinical definition, BMI over 30. Nearly half the adult population. Add in overweight and the number climbs to 76%. 3 out of every 4 people walking down the street. McAllen also ranks number 1 in physical inactivity in all of America. 36.9% do no exercise at all. None. 0 movement beyond what's required to survive. 8th highest diabetes rate. 4th highest heart disease rate. Some of the highest rates of diabetes-related amputations anywhere in the nation. But the children, that's where this becomes generational. 2nd highest teen obesity rate in America. These are 13, 14, 15-year-olds who should be at their healthiest. Metabolism's at their peak, already obese. 5th highest child obesity rate. Elementary school kids, 7 and 8 years old. According to CDC research, Hispanic children born around the year 2000 have up to a 52% chance of developing diabetes in their lifetime. More than half. This isn't some distant future problem. This is happening right now, under everyone's noses. So, how did McAllen become ground zero for a childhood health catastrophe? 5 factors, all connected. And they explain why this could spread to your neighborhood next. Factor number 5, the food desert paradox. The paradox stumped researchers when they first studied McAllen. This region is one of America's hungriest, and simultaneously one of its most obese. How is that possible? How can people be hungry and obese at the same time? The answer lies in what kind of food is actually available. Hidalgo County, where McAllen sits, has one of the highest poverty rates in the nation. Median household income here is roughly half the national average. 40% of the population receives food stamps. Almost half the county getting government assistance just to survive. And yet, highest obesity rate in the nation. According to Texas A&M research, much of the Rio Grande Valley is classified as a food desert. People have to travel 10 to 15 miles just to reach a grocery store with fresh produce. No car, no healthy food. Many families don't own vehicles. Public transportation barely exists. A simple trip to buy vegetables becomes a logistical nightmare. But easy access? That exists. Convenience stores, fast food. Studies show neighborhoods in Hidalgo County have the best access to corner stores and drive-thrus, and the worst access to supermarkets. The ratio is completely inverted. People who live on the border have a saying, on one side you're skinny, on the other you're fat. Cross from Mexico into McAllen and your children's lifespan drops. Same families, same genetics, same culture, different food environment. This isn't about willpower. This is about what's available. When the only affordable, accessible food is engineered to make you sick, getting sick isn't a choice. It's an inevitability. But wait until you see what that food environment does to their bodies. SX factor number 4, the diabetes explosion. The Rio Grande Valley has a diabetes prevalence of 30.7% among adults. Let that number hit you. National average? About 12%. Nearly 3 times higher here. Almost 1 in 3 adults walking around with a disease that attacks every organ system in the body. Diabetes damages blood vessels, destroys nerves, attacks kidneys, eyes, heart. It's one of the leading causes of blindness, kidney failure, and limb amputation in America. At one clinic near McAllen, reports indicate approximately 28 people are diagnosed with diabetes every single day. Local residents describe diabetes-related amputations and blindness as routine. Not shocking, routine. Something that happens to their neighbors, their family members, everyone they know. The valley has one of the highest rates of diabetes-related amputations in the entire country. Local vascular surgeons report 2 to 3 amputations per week at each hospital in the region. Every week. Legs removed because blood flow has been destroyed by uncontrolled blood sugar. And something changed. This should alarm everyone. It's not just adults anymore. A 2021 study in the New England Journal of Medicine followed over 500 young people with type 2 diabetes for up to 15 years, teenagers and young adults who developed diabetes before age 20. The study tracked what happened as they got older. By their late 20s, 60% had at least one serious complication: kidney failure requiring dialysis, heart attacks, strokes, amputations. In their late 20s. People who should be starting careers, getting married, having children, instead dealing with complications that used to only appear in seniors. The lead researcher called youth-onset type 2 diabetes a distinct and disruptive pathophysiology. In plain language, when children get diabetes, it's worse than when adults get it. Their beta cells, the pancreatic cells producing insulin, fail faster. The disease progresses more aggressively. More resistant to treatment, medications that work for years in adults stop working within 1 or 2 years in young people. Same condition, different outcomes, much worse outcomes. Diabetes used to be called adult onset because children almost never got it. Doctors saw it only in patients over 40. Now they're diagnosing it in teenagers, preteens, elementary school children. A 9-year-old in McAllen named Antonio now takes his mother's cholesterol medication. 9 years old, sharing her prescription because they can't afford 2 bottles. Not a statistic, a child. And the city itself makes everything worse. Factor number 3, the infrastructure trap. Something important emerged when researchers actually walked the streets of McAllen. The food is only half the problem. The city itself is built to make walking impossible. 4-lane roads with no bike lanes, no shade trees. Summer temperatures regularly hit 100 degrees. Sometimes 110. The asphalt radiates heat back up from the ground. Nowhere to hide from the sun. Anyone who tries to walk in the afternoon risks heat exhaustion. And the sidewalks? They just end. Literally stop in the middle of nowhere. 1 second you're walking. Next second you're on dirt or grass, or straight into traffic. No continuity, no planning, no consideration for pedestrians. Crosswalk buttons that don't even work. Push them and nothing happens. The light never changes. Infrastructure supposed to protect pedestrians simply doesn't function. Installed and forgotten. McAllen has the 2nd lowest access to parks and recreational facilities in all of America. Public buses come once per hour. Miss one and you're waiting 60 minutes in Texas heat. Most people here get only 2,000 or 3,000 steps per day. Health experts cite 10,000 as a common target. One local doctor told PBS NewsHour, "We are the most obese, the most diabetic, most hypertensive, the poorest, and an average education level of 8th grade. The people most vulnerable, least resources, surrounded by the worst food and worst infrastructure. Not coincidence, a system. But even when people want help, there's another barrier." Factor number 2, the healthcare gap. Approximately 1/3 of Rio Grande Valley residents don't have health insurance. 1 in 3 people in this region. No regular access to healthcare, no annual checkups, no early detection, no prevention. And there's another barrier, one that rarely gets discussed. Immigration status. Many families have mixed documentation. Children born in the US, parents who are undocumented, they don't go to clinics because they're afraid of being detained. They don't pick up medications because they're afraid of being deported. One community health worker said, "There were people who didn't go to the clinic to pick up their medication because they were afraid. I struggle to get people to their appointments." A local health official put it bluntly, "If they don't go to work, they don't get paid. A lot of our patients are day laborers. They're having to pick between sustaining life with their family or their own health." When the choice is between feeding your children today or managing your diabetes tomorrow, diabetes loses. Every time, prevention becomes impossible. People only seek medical care when they're already in crisis. By then, the damage is done. Now. Remember I said factor number 1 was the most dangerous? The one nobody talks about? Here it is. Factor number 1, the cycle of normalization. This might be the most dangerous factor of all. In McAllen, obesity and diabetes have become normal. When everyone around you is overweight, when every family has someone with diabetes, when amputations happen to your neighbors, it stops feeling like a crisis. It feels like life. And that's what makes it so dangerous. A crisis demands you notice it. But when tragedy becomes ordinary, people stop noticing entirely. A local health advocate named David Seron grew up in McAllen watching his family suffer from diabetes. He now goes to elementary schools to teach children about the disease, because many of them have never been told that type 2 diabetes is preventable. Pause on that for a second. Children who have never been told this disease is preventable. They assume it's inevitable, like getting older, like gravity. He tells them, if you don't take care of yourself, if you eat unhealthy, if you don't exercise, you might get type 2. I didn't listen to my doctors. I don't want you to go through what my family went through. Children in these schools have parents with diabetes, grandparents who've lost limbs, siblings on medication. They've never known anything different. Breaking that cycle requires changing what normal looks like, and that's the hardest intervention of all. What actually reverses this? Childhood obesity isn't a life sentence. Early intervention works. Families can change. Communities can change. The Diabetes Prevention Program study demonstrated that lifestyle intervention reduces the risk of developing type 2 diabetes by 58%. More effective than medication. The evidence points to what actually works. Whole foods, not processed, not packaged, real food, fruits, vegetables, nuts, seeds, legumes. Foods that fill you up because they contain fiber. Foods that give your body nutrients it's actually asking for. The Mediterranean diet reduces cardiovascular disease risk by up to 30% in high-risk populations. When you eat real food, something happens. You get full. You stay full. Your body stops screaming for more because it finally got what it needed. Ultra-processed foods are designed to bypass satiety signals. Research shows people consume 500 more calories per day eating ultra-processed foods compared to whole foods. Same fullness. More calories, by design. Movement matters too. Doesn't have to be a gym. Walking, even 7,000 steps a day, dramatically reduces health risks. At least 60 minutes of moderate activity daily for children. Walking, playing, moving. Research from the American Heart Association shows regular physical activity lowers blood pressure, improves cholesterol, and reduces type 2 diabetes risk by 25 to 40%. Consistency matters more than intensity. Breaking up prolonged sitting with just 2 minutes of walking every 30 minutes significantly improves blood sugar regulation. Small changes, repeated daily, compound into major improvements. Understanding what's in your food matters. High fructose corn syrup, seed oils, chemical additives, preservatives you can't pronounce. These aren't food. Engineered in laboratories to hit the exact combination of salt, sugar, and fat that overrides your body's natural fullness signals. Food scientists call this the bliss point. Precise formulation maximizing craving while minimizing satisfaction. Once you understand this, you can't unsee it. Every food label becomes a story about what that product is designed to do to your body. In McAllen, organizations are fighting back. Texas A&M's Working on Wellness program established farmers markets, where residents use food assistance vouchers for fresh produce. Built walking trails, created community gardens, brought healthy food to food deserts. The South Texas Juvenile Diabetes Association educates families about prevention, something almost unheard of a decade ago, changing the conversation from treatment to prevention. Individual families are making changes. One mother named Blanca, whose 9-year-old son Antonio was sharing her cholesterol medication, finally said, "It ends today." Started attending nutrition classes, clearing out processed foods, teaching her children that this doesn't have to be their future. The American Academy of Pediatrics now recommends intensive lifestyle intervention for children with obesity starting at age 6. Not waiting until they're teenagers, not waiting until they have diabetes. Acting now. The warning: McAllen isn't unique. It's just further along a path many American communities are walking. Nationally, childhood obesity has nearly tripled since 1980. 1 in 5 American children is now obese. According to the CDC, 42% of American adults are obese, up from 30% just 20 years ago. The New England Journal of Medicine warned, unless effective population-level interventions are developed, the steady rise in life expectancy observed in the modern era may soon come to an end. That was written in 2005. 20 years later, we're watching it happen. The same patterns exist in communities across America. Food deserts, poverty, limited healthcare access, normalized obesity. Maybe in your community right now, maybe closer than you think. Look at your city. Take a hard look at it. Really examine what's around you. How many fast food restaurants within a mile of your home? How many grocery stores with fresh produce? Can you walk to get what you need? Can your children? McAllen isn't a distant problem. It's a warning. 5 factors, all connected, all preventable. Food deserts making junk food the only option. A diabetes epidemic hitting children who should be healthiest. Infrastructure making walking dangerous. Healthcare that a third of residents can't access. And normalization making tragedy feel like everyday life. But McAllen also shows change is possible. One family at a time, one school at a time. If this information matters, share it with someone who needs to see it. Take care of yourself, and take care of the children in your life. They're watching what you do, learning what normal looks like from you. Now, if you're ready to take control of your health today, there's one natural remedy researchers are calling remarkably powerful. Watch. The 10 biggest black seed oil benefits you've been missing for years. It's appearing on your screen now.